I think there are several. Historically, we've defined a patient to have a limited number of metastatic sites of disease or oligometastatic disease, or as three or fewer lesions of spread. And the reason we chose that number is because we want to identify subsets of non-small cell lung cancer patients who may benefit from local treatment. But that's purely a number kind of pulled out of the air. What we need to do is develop better predictive and prognostic models of understanding which patients truly have oligometastatic disease versus those patients who are going to develop widely metastatic disease, in the hopes that we can identify the most optimal patients that will benefit from our local treatment approaches. So that's one really outstanding question in the field. Second question is sequencing and timing. When should we add this radiation? Should we add this radiation for these oligometastatic non-small cell lung cancer patients at their time of diagnosis? Should we treat the metastatic lesions only at the time of what we call consolidation, or after they've gotten 3 or 4 courses of systemic therapy? Or should we include this treatment only when they progress, then only if they have oligoprogression? So that's an important question, the one about sequencing and timing. Then there's some other traditional intrinsic questions that make sense, such as what is the optimal radiation dose? What is the optimal number of treatments that we need to employ in order to facilitate optimal tumor control? Because at the end of the day, it's a synergy. It's a synergy between systemic therapy, and it's a synergy with its effects on local therapy and vice versa. So we want to make sure that what we're doing has an appropriate synergy between the local and systemic therapies. So I think those are three, fundamental questions that still remain unanswered. A fourth question you can add is, what is the best metric or readout of whether this treatment is successful? Certainly, if we improve the overall survival of a patient, that is going to suggest a very successful benefit of local therapy. But how about progression-free survival? How about decreasing the amount of circulating tumor DNA? These, again, are important questions that are yet to be answered.